Hello, today we are at the Martini Klinik in Hambourg, specialized in the prostate cancer treatment. I'm with Professor Matthieu Durand, chairman in urology at the Nice Academic Hospital, and we're going to show you how the implementation of the care syntax system improves patient safety, outcomes, and training in the prostate cancer treatment, thanks to video recording and analysis of surgical procedures. Come on in.
Hi, nice to meet you. Detlef Loppow from Martini Klinik.
Professor Durand, we're going to meet you later at the operating room, right?
Sure. So, see you.
So, can you introduce to us the Martini Klinik?
Martini Klinik was founded in 2005 as a specialized clinic only for the treatment and the diagnosis of patients with prostate cancer. We have the biggest group of active surveillance patients in Germany. We are worldwide the largest center for radical prostatectomies.
Here, the care syntax system was implemented in August 2024 in order to share the clinic's expertise to other hospitals.
As a specialized clinic, we are able to deliver some knowledge about processes and so that can reduce risks for other hospitals that do the same surgeries, but not in this large number of cases. I think we can offer a role model for standardization. All three parties work for safer treatment strategies, and this is the most important thing in our collaboration.
Would you recommend the care syntax system to other establishments as the managing director?
Yes, I would, because even in this big university hospital complex, from my point of view, it's the only project where the IT department of the University Medical Center was satisfied. The medtech part of our company was satisfied, and the vendor, Care Syntax, was also satisfied. So we have three parties working together successfully, and I think the idea and what Care Syntax has already in the pipeline, these are the most important things for the future. The future might be that the system tells you, well, I would not do the cut here, you should do it elsewhere. Or have you already checked for some allergies in the patient because you forgot to set the flag there? Yeah? So you have an artificial net that helps you to reduce the normal human error level a lot.
So now we're going to the operating room in order to understand how the care syntax system actually works. From here, it only looks like a brand new sophisticated operating room, but there is a twist. Here, thanks to the care syntax system, from the very beginning, meaning the entry of the patient in the operating room until it goes out, data and video are recorded. Here or even here, they're collected and sent to the patient's medical record, which includes his medical history, biology, and imaging. All the operating rooms are equipped with the care syntax system. But how does it help surgeons in their daily practice? Professor Durand had the opportunity to discuss it with Professor Haese, urologist at the Martini Klinik.
So this is something you use for training or for path review? Or?
First of all, as an archive, we use it to let every surgeon has his procedures available. If after a certain while, if a patient turns out very good in terms of continence or potency, we can go back and see why it is like that. Another helpful tool is, of course, when we have complications, which of course occur, then we can try to see why specific complication has occurred. Why does it happen that the patient was bleeding afterwards, and then go back and look at the video and see if we can spot the cause for this. Or, for example, this morning we had a procedure where actually a needle was broke. The surgeon did a stitch and the needle broke in the tissue and we couldn't spot it anymore, so we actually stopped the video recording and then went back to the recorded procedure itself and put it on slow motion, and then you could actually see where the needle was, so that we found it during the procedure, which was quite a relief. And for training, of course, you can pick selected cases where went very fine to teach somebody, or use very specific cases when you say this is how you handle very large prostates or whatever. It must not necessarily a prostate, and then you can create a training pathway out of this. This is how it's doing, and then of course, as many surgeons do not have that high volume as we have, it might be that they don't see certain special cases.
Okay, so this is definitely the future.
I'm sure it's going to be like that.